Hello everyone, my name is Bharti Chauhan and I'm working as an assistant professor in IIMT group of colleges, Greater Noida. So today I'll be delivering a video lecture on topic of hospital pharmacy. This is the content for my slides. So before moving on hospital pharmacy, we should know what is hospital. So according to WHO expert committee in 1963, a hospital is a residential establishment that provides short-term and long-term medical care consisting of observational, diagnostic, therapeutic, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury. It may or may not also provide services for ambulatory patients on an outpatient basis. So basically, it provides a healthcare routine or suspect if anyone is suffering from any other disease, it provides the observation and diagnostic therapeutic services to that person, and it may vary that he may not or maybe is an inpatient or can be an outpatient. So this is the classification of hospital based on objective. It is divided in three types, which is general hospital, special hospital, teaching cum research hospital. It means there is also a education institute and within which is collaborated with the hospital so they can research and gain practical knowledges from with respect of their teaching facilities. Second is basic on administration, ownership, control, or financial income, which is government or public. Second, non-government or private. And third is semi-government hospital, which is hospital run both by the government and private entity. Example, Kent Ford Hospital, which is a basic example of this subtype. Fourth is corporate hospital. Corporate hospitals, which are public limited companies formed under the Companies Act or run on commercial lines. Example, Apollo. You can see on every residential places, you can easily see the sign of Apollo. So this come under corporate hospitals. As per WHO classification, which is a main classification you have to study and write. So which is it divided in three parts. First, regional hospital, example, government medical college hospital. Second, intermediate or district hospital, the hospital which is present in a particular district will come under this classification. Third is rural hospital. Rural hospital, you can say, is a hospital which is present in a village. Okay, so it comes under this type of classification. So now this is our topic, which is hospital pharmacy. I think you may be clear about the hospital. So after that only you have to study about hospital pharmacy. So definition is department within a hospital that prepares, compound, stock. These 3 points you should note and write is a key point. Plus dispenses inpatient medication under the supervision of a professional pharmacist is known as hospital pharmacy. Next is hospital pharmacies usually stock a larger range of medication, including more specialized and investigational medications, medicine that are being studied but have not yet been approved. Okay, hospital pharmacy may also dispense over the counter and prescription medication to outpatients. So now, if we talk about the national and international scenario about the hospital pharmacist or pharmacy, is that the conventional role of pharmacist is to manufacture and supply medicinal products simple, but the pharmacy profession is still lagging behind in developing countries as compared with developed countries. You can say about the India, right? But in USA, the pharmacists are doing more than the work of dispensing the medication. This is the difference between developing countries and developed countries. So, here, in a way that the pharmacy professionals have never been considered as a part of healthcare team, neither by the community nor by the healthcare provider. This is a very, you can say, a fact about the pharmacist that every person in your uh, relatives, or you can say close ones, only think about that the pharmacist can only do the dispensing work, but this is not the truth. Okay. In a recent study in UK, researchers found that most of the pharmacists were involved in advising the doctors and educating the patient. Pharmacists in developed countries have shown zeal in upgrading their knowledge and have refined their professional skills to meet the healthcare demands. Recently, there is a significant change in the pharmacy profession in terms of professional services due to increases in complexity, range of medicine, and poor compliance have shifted the focus of pharmacists toward the patient-centered approach. This situation here made pharmacy discipline to be recognized as an equally uh, profession and multidisciplinary team for the provision of healthcare. So now, slowly, the pharmacists are getting their recognition among the other healthcare professionals, which is very important. The Good Pharmacy Practice Guidelines, developed by the FIP and subsequently adopted by the World Health Organization, state that a pharmacist's first concern should be the welfare of the patient. In developing countries, there are opportunities for pharmacists to become more involved with patient cares. In many parts of the world, pharmacists have played a significant role in provision of pharmaceutical care services. In addition, it is also widely believed that pharmacists can make a great contribution to the provision of the primary health care, especially in developing countries. So, pharmacists can also help the primary health care provisions, right? Many researchers have found that in developing countries, prescribers are in favor of the new extended role of practicing pharmacists as patient, counselor, and drug information providers. So, this is the point that pharmacists are not only having their role as a dispensing, right? They also play a very significant role in other fields. You can say as a patient counselor, drug information providers, or you can say clinical pharmacy is also there. So, but also, and this happen is a suitable place in healthcare system. So, however, there are difficulties with identifying their role and responsibility, having those recognized by hospital administrators, government, and patient. So, next is roles and responsibility. That is only about the national international criteria of the pharmacist. Now, we should know what are the basic role and responsibility of hospital pharmacists. First, role of pharmacist. The basic role by which pharmacists work in hospital can be different depending on the size of the hospital and number of patients coming in or who are in need of pharmacy services. There can be a single main pharmacy or as many as multiple pharmacies around in every department, depending on the need and utility of medicines. Typically, a large tertiary care health facility will have several pharmacy stations where pharmacists must be employed. Now, different role of pharmacist. You should know now you will know what are the different roles played by a pharmacist is not only by its like dispensing of the medicines. No, there is more than that. So, firstly, is the implementation of decision of therapeutic committee. Second, dispensing of drugs, pharmaceuticals, and chemical or different area, which is the major role, right? Third, maintenance of approved stock of emergency drug and antidotes. Fourth, dispensing of narcotic drugs and accounting. Specification for various fluids. Inspection of drugs at various point of use. inventory control, maintenance of stores, ledger and records, provision of alternate electricity supply, inspection and quality control, teaching and training pharmacies, periodic utilization report of pharmacy, and last, patient education. Now, major work responsibility of a pharmacist in a hospital. Now, we will only talk about the role of pharmacist in a hospital is check prescription and ensure their safety for the individual patient. Participate in ward round. Ward round is also important to take a patient history and counsel nursing staff on the correct delivery of prescribing drugs to the patient. That is also important. Advise and counsel other medical staff on appropriate doses and drug delivery regime. Keep up to date knowledge of drugs and their safety and contribute to research and development. Make guidelines and oversee their implementation. Discuss the treatment plan with the relative person and its relatives or caretakers. Other major responsibilities may include ensuring cost effective treatment, setup of clinical therapies, and supervising clinical trials. The pharmacist should know their ethics first, right? They should not prescribe the medicines which are very costly. They should always be humble and reasonable prices should be delivered to a patient that can be convenient. Next, qualification and experience required. The chief pharmacist or director should have minimum postgraduate degree in pharmacy, preferably in pharmacology or hospital pharmacy. And second, manufacturing chemist should be graduate in pharmacy with minimum 18-month experience in manufacturing process of drugs and formulation. Analytical chemist should be postgraduate in pharmaceutical chemistry or analytical chemistry. Fourth is registered pharmacist and pharmacist cum clerk should have diploma in pharmacy and should be registered in state pharmacy council. So now, if we discuss workload requirements, what is workload? You should know first the amount of work or of working time expected or assigned with a heavy workload. The amount of work performed or capable of being performed is usually within a specific period. So, workload requirement for hospital pharmacists is can be viewed in terms of work characteristics or professional responsibilities. Work characteristics can include hour work per week, the proportion of time a respondent worked as the only pharmacist in his or her pharmacy department, the proportion of prescription dispensed at the site with which the respondent was involved personally, the number and types of interaction pharmacists have with other on a typical day. What is a typical day of hospital pharmacy? So these are the list which may include the following activities. First, managing pharmacy related services and logistic 24 by 7, prescribing medications daily and ensuring their safety and efficacy, preparing all the medication and converting dosage forms to the applicable situations, contacting all healthcare provider for medication related issue if someone is experiencing drug related issues like some side effects or adverse drug reaction, they should contact all healthcare providers, right? Right. Next is participating in clinical rounds run by all healthcare provider and attending pharmacy managed clinics. Next is providing adequate statistic on medication consumption and managing medications stores and planning for medication budget, providing drug information services, conducting pharmacy-related training for under and postgraduates, supervising pharmacy-related research activities. Now, the hospital pharmacy is integrated with the dispensing section, manufacturing section, quality assurance section, and clinical pharmacy services. The requirement of bed you can see in this table is the per bed there should be a criteria of the pharmacist present in the surrounding of that bed. So up to 50 beds, you can see the number of pharmacists are required 3. Up to 100 beds, the number of pharmacists are required 5 to maintain all their routine as they are taking the drugs regularly or by a particular period of time after food or before food, and how much IV they are giving, what boys are giving. So these are the some specification that should be considered by the pharmacist. So around the up to 200 beds, there should be a number 8 number of pharmacists required, and up to 300 beds, 10 pharmacists are required around the area. So last up to 500 beds, there are 15 number of pharmacists which are required around the area. Next is job specification, which is employee specification. If you are applying for any other job, you should know first what is the specification of the job or what is the work for the job. So first, a job specification is a written statement of educational qualification, the specific qualities that are required to apply that particular job or level of experience which is required, physical, emotional, technical communication skills required to perform a job, responsibilities involved in a job, and other unusual sensory demands. It also includes general health, mental health is particular that a person should be a mentally stable, right? Uh, he should have intelligence, aptitude, and memory, judgment, leadership skills with emotional ability, adaptability, should be flexible around their time, values, and ethics are most important for the role of pharmacist. So manners and creativity is also one of them. Now, purpose of job specification. What is the purpose? It usually describes on the basis of job description, job specification help candidate analyze whether they are eligible for that particular job or he or she can apply for a particular job vacancy or not. Next, it helps recruiting team of an organization understand what level of qualification that they demand or a person should have, right? Set of characteristics should be present in a candidate to make him or her eligible for the job opening. Next is job specification gives detailed information about any job, including job responsibilities, desired technical and physical skill, conversational ability is most important, and much more. It helps in selecting the most appropriate candidate for a particular job. Write about qualification, experience, and responsibility involved in job when asked job specification of hospital pharmacist. Now, hospital pharmacist job description. A hospital pharmacist job description includes key duty. So these are the points you should have in your mind before applying any hospital pharmacist job. So first is ensuring medicinal products are stored appropriately and securely to ensure freshness and potency. Ensuring medication reaches the patient in the correct, correct form and dose. You have to calculate the dose according to the age or weight of the patient, right? This may include tablets, capsule, ointment, injection, inhalers, and cream. Being responsible for the accurate dispensing and timely distribution of drug and medicine for inpatient or outpatients. Next is supervising and checking the work of less experienced and less qualified staff. Now, responding to medication related queries, you should always be ready. So, you can tackle any query, right? And you have to resolve that person's query. This ability should be present in a hospital pharmacist, right? From within the hospital, other hospital or general public. The question or query may arise from general public. He or she can be an outpatient or inpatient, right? Next is keeping up to date with contributing to R&D, which is important, often in collaboration with medical staff and colleague in the pharmaceutical industry, so you can develop a better medicine. Every time there is million of medicines are being uh, developed, right? So you should collaborate with pharmaceutical industries also. Next is writing guideline for drug use within the hospital, preparing bulletins, and implementing hospital regulations. Now, providing information to individual wards on budget and expenditure on drugs, setting up clinical trials, evaluating new medication against claims made by pharmaceutical companies, and recommended new medicine that are safest and most effective for individual patient needs. Now, participating in ward rounds, which is very important, taking patient drug histories, contributing to the treatment, or may, according to them, you have to change the medication if they are showing any side effect or adverse drug reaction. These are all the points that you have to keep up in your mind. Liaising with physician, nurses, or other fellow healthcare professionals to ensure the delivery of safe, effective, and economic drug treatment. Now, counseling of patient is also a part of a hospital pharmacist on the effects, which are the effects of the drugs and the doses which have to be provided by them. And route of administration is also important. You are taking the drug with orally or by IV, right, or IM, intramuscular, intravenous. So, all the drug treatment, particularly those who require complex drug therapies. Monitoring every stage of medication therapy to improve all aspects of delivery and reporting patient side effects. You should always be taking notes of the patient side effects and report to the pharmacovigilance department of that particular drug. Now, communicating effectively with patient relatives, community pharmacists, general practitioners, etc. Now, okay. So this is the interrelationship which is important is the effective communication between pharmacists is very important and doctors, nurses about patient medication. So if this communication is not present, then the therapy which are provided to a patient will not be successful. So effective communication is a part of the therapeutic activity that the healthcare professionals are being implementing on the patient, right, for their well-beings. Now, within pharmacy, doctor nurses about patient medication is particularly important, especially hospital setting where high-risk medicine are frequently used. It is crucial for members of various professions to maintain positive working relationship as a pharmacist dispense medication that nurse give and doctor prescribe. This is a you can say if one person is not present, right? Without pharmacist, the hospital is incomplete. Without nurse, the hospital is incomplete. Without doctors, you cannot imagine a hospital, right? So every healthcare profession plays their individual role for maintaining the well-being of a patient. So they should be in a humble or good harmony relationship. So next point is these connections are essential for the effective functioning of the hospital formulary system, promotion of rational drug therapy, safe and effective dispensing and administration of medication. You can say if you are going for you are having a fever, right? You will be going to the doctor first. He will give a give you some advice regarding your uh, fever or prescribe some medications, right? And you will be next going to a pharmacist. So each healthcare professional have their particular role to play in the therapy of a patient. While seeking permission, next is the seeking permission for a proposal or to give recommendations. Chief pharmacists have a variety of methods of communicating with the medical staff. And now here you can see the role of chief pharmacist, which is initially the issue should be discussed with the pharmacy and therapeutic committee, and then advice should be given to the medical staff. Next, requesting the administrator to inform the medical staff about the issue, informal discussion with the medical staff about the issue. These points should be considered by the chief pharmacist only. Now, last is the professional relationship of hospital pharmacist. A pharmacist, what is a professional relationship? That you can understand by that a pharmacist can promote his profession by the following programs: by maintaining a professional relations with the medical research staff, physician, clinical nursing staff, or other healthcare professional with the hospital or the employing institution, by maintaining a professional relationship with medical representative and suppliers. These, these are the demands. You can say the hospital pharmacist should every time, you can say, maintain these relationships if he want to do a work in any hospital, or you can say in community pharmacy also, he have to maintain particular relationship that can boost his business, right? Community pharmacy is a type of pharmacy that is very, you can say, that can only run by the help of a wholesaler, right? Or MR, all plays a very important role. So these are the relationship that you have to maintain with MR in hospital pharmacies and suppliers. You have to maintain a relation with the general public and patient, relation with the pharmaceutical industry, teaching information service of the hospital, education service for the public, activities of professional association and hospital administrative works. So by providing service through various hospital committees. So basically, this is all about the hospital pharmacy. I hope you all have already understood about this topic. And if you have any other queries, you can drop your comment in the comment section. That's all for today. Thank you so much for listening to my video lecture.